All right, let's get down to some medical business now. There's some disturbing new research this week about your health care. By 2013, only about 1/3 of all U.S. doctors may still be in a private practice. That is according to a new study by the management consulting firm known as Accenture. Now, it finds that physicians are selling their practices to work for larger healthcare systems instead. And Dr. Manny Alvarez is none too happy about this. He is the senior managing editor of FoxNewsHealth.com. Dr. Manny, welcome. Good to see you.
Hi.
The doctor is in.
Yeah.
What's going on here?
Well, look, this is the agenda of the federal government. The federal government, ladies and gentlemen, want you to they want to develop a socialized healthcare system. They want all the doctors to work under one big umbrella. They want all patients to just adhere to one kind of medical health system. Ultimately, this is what is happening right now. Accenture, who came out with a survey that says 1/3 of private doctors are going to go into these hospital-based types of practices, works for the federal government or works with the federal government because they are the ones that are looking at loopholes to cut down costs. So they figure, well, let's coerce all the physicians, telling them that, oh, you're going to have more free time, we're going to pay your insurance, we're going to give you all of these beautiful bells and whistles, electronic bells and whistles that to monitor your patients, to have electronic medical records. And the private practitioner, basically he's being put out of business. He or she cannot afford to keep his practice open anymore. They can't afford the reductions in reimbursement. They can't afford the malpractice premiums. They can't afford all of this. So this is destroying the entire healthcare system.
It's like they're crying uncle, right? Yeah, they're saying, you've been twisting my arm for so long, I simply can't take it anymore. I'm going to go work for basically a big corporation.
Exactly.
And provide health care, and I'm going to have 9 to 5 hours,
right.
And I'm going to get paid.
And the second side to this equation is the fact that, and people don't know this yet, they don't realize your information will be available. It will be mined by the federal government, so they would know exactly what's going on in every aspect of your life. They know exactly the medications that you're taking and why you're taking them. Who has
time to? But this is what I want to know. No, who's got time? The federal government can barely get the mail in your post office box, and you're telling me that they're going to have time to sort of go through all of my records and say
Yes, that's what they're doing right now, and that's what they're going to do. And when they have
to the end of saying Martha can or cannot have this procedure done.
To the end to say that, oh, we know better than your doctor, and therefore we're going to come with policies that, all food has to taste this way, all salts have to be eliminated, you have to live to be 100, you cannot retire until you're 72, and you're going to get penalized. All of this is just coercion to control.
Tell me if I'm wrong, but this is what I think is going to happen because of something that I've seen happening here in New York. Basically, rich people are going to be able to have their own private doctor.
Welcome
and everybody
to Europe.
else is going to get dumped into these big corporations where you're going to be sitting for an hour and a half waiting for your appointment.
Welcome to Europe. My wife is from Sweden. And again, my father-in-law worked very hard for the Swedish government for many years. And you know what? When he was sick, and I would visit him to Sweden, he had to wait in line, and he was a good citizen. But it took just too long. And my wife came to me one day and says, my father's suffering. Can you help him? And I flew my father-in-law to America, and we did his surgery, and he went back. Yes, if you're rich in Europe, you can get whatever you want. But if you're a working class person in Europe, you have to stick
to the way it's going to be here.
And that's the way it's here. It's just a degree of people are not feeling it yet, but trust me, everybody out there, you're going to be feeling it in a couple of years.
Yeah, that's bad. Dr. Manny, thank you very much.
You got it.
It's good to have Dr. Manny in your family. Yeah. It's also the moral of the story. Thank you, Dr. Manny.
Thank you.
Good to